Stress and stress responses are common in clinical environments for clinicians, nurse educators, and students. The purpose of this brief video is to review common stress reactions and responses to stress, review a brief breathing exercise, and identify strategies that nurse educators can use to reduce and manage stress in the clinical environment. By the end of the video, you will verbalize common stress reactions and common sources of stress in the clinical environment, identify anticipatory guidance to help students prepare for the clinical day and reduce stress, engage in a breathing exercise that can be helpful for in-the-moment stress, and identify strategies to reduce stress and to manage stress in the clinical environment. In fast-paced and ever-changing contemporary clinical environments, there are multiple stressors for nurses at every stage of their professional development. These include uncertainty about what to expect for the day or with a certain patient, fear of making mistakes or fear of failure, challenging and high-need patients and families, supporting other staff members, peer interactions, lack of knowledge or nursing skills, unfamiliarity with patient background and needs, learning new responsibilities, workload, and emotionally challenging care situations like death and dying. For nurse educators, there may be levels of responsibility and accountability on top of all of these related to student needs and outcomes. For students, there may be additional challenges related to coursework. For both educators and students, there may be stressors related to other responsibilities within the university environment. There may also be stress spillover into work for individuals who have high levels of stress at home. The body has physical and mental responses to stress, including rapid heart rate and breathing, muscle tension, increased blood pressure, hypervigilance, and irritability. Nurse educators, clinicians, and students can learn to recognize stress responses in themselves and others. This allows them to manage stress in the moment and prevent long-term stress and its consequences. Nurses are particularly at risk for burnout, which may result from prolonged and unmanaged stress. A common issue that can arise for students is fainting or vasovagal syncope during the clinical experience. There are some anticipatory guidance measures that clinical educators can recommend to prevent this and other stress-related issues. This might include adequate sleep before the clinical day, adequate hydration, such as bringing a water bottle for the break room and taking bio breaks, and adequate nutrition. This would include eating well the night before, having breakfast, and bringing snacks for bio breaks. Specific to fainting, remind students to bend their knees and change weight distribution periodically when standing for a long time, and to take deep breaths while watching new procedures. Also, remind students that if they feel faint or dizzy, they need to promptly sit or lie down to avoid injury. It would be best if they can lie down and elevate their legs. If they can only sit down, then they should put their head between their knees. Students should also let someone know they are feeling dizzy. An easy way to mitigate stress in the moment is to be aware of the acute symptoms of stress and respond in an adaptive way. Focusing on breathing through mindfulness exercises can be an easily deployable tool in the moment because the breath is always with us. Mindful breathing exercises at home, before shifts, at the end of shifts, during post-conference and pre-conference, or any other touch point of the day can help individuals develop adaptive approaches to acute stress. People may not always have the time to go through a whole mindfulness exercise, but stopping, centering, and taking slow, deep breaths can be helpful in addressing the body's sympathetic activation. Here is a longer breathing meditation that can be practiced at home and may help people better respond with breathing in the moment. Find a comfortable seated position and allow your eyes to close or soften your gaze. Begin by taking several long, slow, deep breaths, breathing in slowly and exhaling fully. Breathe in through your nose and out through your nose or mouth. Notice the differences between the inhale and exhale, the cool air as it enters your nose and the warm air as you exhale. If your mind wanders to thoughts, plans, or problems, simply notice and then practice letting it go. Notice when your mind has wandered and practice coming home to the breath with your full attention, feeling the stomach rise with the in-breath, letting go with the out-breath. You might become distracted by pain or discomfort in the body, or feelings such as sadness, happiness, frustration, or contentment. Notice these distractions without judgment, and then refocus on the breath. Breathe in and breathe out, following the air all the way down through your lungs and out through your mouth. Be present in the moment with your breath. Slowly allow your attention to expand and notice your full body and the room where you are. When you are ready, open your eyes. As a clinical educator, you can both model stress management and prevention and create an environment that reduces stress and celebrates efforts to manage stress. Some examples would be teaching strategies to help learners with new skills in the clinical setting, including cognitive rehearsal. Cognitive rehearsal is mentally reviewing steps for clinical skills. Looking at workload for yourself and students and thinking about what is manageable. Teaching and modeling boundary setting and saying no. Rewarding and modeling asking for help. Talking about stress and strategies to prevent and manage stress. And creating a community where nursing students and clinicians can be vulnerable and honest about their needs without social or organizational punishment.